Now, the Health Secretary Jeremy Hunt and the renowned physicist Stephen Hawking have clashed over the way the government is reforming the NHS. Professor Hawking has accused Mr. Hunt of cherry-picking scientific evidence to justify the creation of a 7-day health service. Well, in a lecture later today at the Royal Society of Medicine, he'll say Hunt had cherry-picked research to justify his argument. For a scientist, cherry-picking evidence is unacceptable when public figures abuse scientific arguments, citing some studies but suppressing others to justify policies they want to implement for other reasons. It debases scientific culture. Well, in response, Mr. Hunt has tweeted, "Stephen Hawking is a brilliant physicist, but wrong on lack of evidence for weekend effect. And whatever entrenched opposition, no responsible health secretary could ignore it. If you want NHS to be the safest health service in the world, as I do." Well, let's head live to Westminster, and our chief political correspondent John Craig is there. And John, Professor Hawking is a lifelong Labour supporter, but he's really gone for the health secretary this time, hasn't he?
He's spoken out before, but this time it's personal because he's targeting a claim made by Mr. Hunt as he was trying to bring in 7-day-a-week working in the NHS. A claim that thousands of patients were dying unnecessarily because of what he called poor hospital care at weekends. Now, it's personal for Professor Hawking because, as he will say in his lecture, and he said in an article in the Guardian newspaper today, he wouldn't be alive today if it wasn't for the National Health Service. Now, he's 75. At 21, when he was a student, he was diagnosed with motor neurone disease. At the time, he was told he only had 2 years to live. In 1985, his life was saved by staff at the Addenbrooke's Hospital in Cambridge after doctors at a clinic in Switzerland said they couldn't save him. And then back in 1999, he had a life-saving surgery to remove his larynx. Now that was at the Royal Throat, Nose and Ear Hospital in London. He's also warning about the threat of privatisation in the NHS as he sees it, slashing spending. It's quite a political speech, and as you might expect, his criticism has been endorsed by the Labour leader Jeremy Corbyn.
Brilliant scientist, brilliant mind, brilliant thought process. And if Stephen Hawking is saying that our NHS is under threat and in danger and in crisis, then I think we need to listen very, very carefully to what he has to say. I admire Stephen and I agree absolutely with what he said this morning.
Well, Jeremy Hunt won't be very pleased when he hears Professor Hawking's speech, because he concludes by saying he's going to carry on speaking out and warning of the dangers of increasing privatisation as he sees it, and the moves towards a more American-style healthcare system as he puts it, the NHS moves towards its 70th birthday next year.
John, thanks very much indeed. Well, let's head live to the Royal Society of Medicine in central London, where Professor Hawking will be appearing later today. Dr. Rachel Clark is a junior doctor, campaigner and author, and she joins me now live. Thank you, Dr. Clark, for joining us here on Sky News. This war of words must really be dominating that event. What have the delegates there made of what both Professor Hawking and Jeremy Hunt have been saying?
Well, we are all absolutely in disbelief at the way the Health Secretary has chosen to take on Professor Stephen Hawking. He isn't just any old scientist, he is one of the foremost scientific minds of our age. He is to the 21st century what Albert Einstein was to the 20th, and yet here is Jeremy Hunt, a man with not a shred of scientific training or background or education, actually taking on Stephen Hawking and accusing him of not being as competent as he is at appraising the scientific evidence base. It's an arrogance that even by Mr. Hunt's standards is breathtaking.
But Jeremy Hunt has said in his defence that he was quoting one of the most comprehensive studies ever when he was talking about the weekend effect.
Yes, and I think the problem so many doctors have with Jeremy Hunt's use and misuse of evidence is he has a real tendency to do precisely what Professor Hawking has identified. He cherry picks. So he loves to brandish one study with one statistic purporting to show that 11,000 people lose their lives every year because doctors won't work at weekends, when even the authors of that study have said it would be rash and misleading to draw that conclusion. That study has also subsequently been discredited by much bigger randomised controlled review studies which bring together a great many different papers and therefore are much more credible. Jeremy Hunt, when he comes across evidence and facts that don't suit his political agenda, he ignores them. And the key problem with that is, and I think this is the key point that Professor Hawking is making, it devalues scientific discourse. In 2017, we inhabit a world where experts are being discredited. Michael Gove famously said last year, we have had enough of experts in this country, but medicine is about facts and evidence and data more than anything at all. As a doctor, I look after my patients by treating them according to the evidence. If I have a health secretary who plays fast and loose with the facts, then that debases everything the NHS does.
In your experience, what is the difference in resources between weekday and weekend and how services, and how does that impact on the care that you're able to give to patients?
That's the nub of this question, and like many frontline staff who work a great many weekends as I do, I work around 1 in 4 weekends, I would dearly love to see those weekends better resourced. It's absolutely true that we don't have the same numbers of staff, we're not able to request scans and so on in the same way. That's not because doctors are choosing not to work weekends though, it's because we have 40,000 too few nurses in the NHS and around 6,000 too few doctors. There aren't enough of us to be spread safely across the NHS as it is, let alone across all singing, all dancing, new 7-day services. And that's the nub of the issue. What we need is funding from the governments to have new weekend services. And until Jeremy Hunt commits more than rhetoric to that aim, we're never going to see safety improved.
So what would you like Jeremy Hunt to do next? Should he pause his plans and go back to the research?
I absolutely would like to see him do that. I think it's time for him to stop making inflammatory, off-the-cuff and frankly insulting comments on Twitter to one of the foremost scientific minds of our century. I think he would do well to start taking a leaf out of doctors' books, and he should base his practice on the evidence just as we try to. So the whole of medicine, the whole of treating patients safely is about practicing evidence-based medicine. I would like to see Jeremy Hunt practicing evidence-based health policy rather than basing his policies and his pronouncements on rhetoric and spin, which frankly does not serve the patients in the NHS to any extent at all.
Okay, Dr. Rachel Clark, great to talk to you. Thank you for joining us here on Sky News.
Thank you.
You are watching Sky News. Stay with us. Coming up.